Just to get to know the patient better and just to sort out what are the underlying causes behind the seizure activity, we must go through the patient history in detail and in a very systematic manner. So what are the questions that you're going to put forth to the patient when you're taking the detailed history from the patient? Obviously, the history of febrile seizures, early auras, it can be the different abnormal sensations that the patient has. For instance, it can be a particular smell that the patient has or seeing the flashes of light. These are basically defined as the aurous activity that is sensed by the individual, or even it can be a brief seizure before the major seizure that the patient has. So you're going to put forth all these questions to the patient, and moving on, you're also going to get into the genetic considerations as well, and particularly focusing on the family history of the seizures. Moving on, we have the prior head trauma, stroke, any history of tumors, treated or under treatment, they are going to be taken into account. And then obviously the central nervous system infections are also going to be taken into account. For instance, any history of meningitis or encephalitis that the patient has been suffering from. And then finally, you're going to ask the patient of any sort of sleep deprivation. The sleep patterns are particularly taken into account over here. The systemic diseases, for instance, hypertension, diabetes mellitus, long-standing infectious states, they are also going to be asked for in the history. Then any sort of electrolyte or metabolic derangements are also going to be taken into account over here. So these are the peculiar questions that are basically going to highlight what are the major factors that are contributing towards the development of the epileptic seizures in this individual.